People with personality disorders and complex trauma disorders are hugely misunderstood. If there's one message that I want to get across today is that borderline personality disorder and personality disorders and complex trauma disorders are treatable.
Hi there, Sathya. How are you going?
Hi, Anthony.
It's great to be here today to talk to you about your recent recognition as an Order of Australia medal recipient, which I think is great recognition for the work that you've done over many years. What does this recognition really mean to you?
Anthony, thank you. Look, I've just done what I usually do, and see, this is the work which I'm passionate about, and I thoroughly enjoy this work. It's a validation and it's an endorsement for the patients that I work with, their families and their carers, and the staff of Spectrum in general.
Yeah.
And the Australian Borderline Personality Disorder Foundation that I very actively am involved in. See, I work with patients with personality disorders and complex trauma disorders, and they experience very painful emotions, and they experience a lot of suffering. I see this recognition as a validation of their distress and their suffering, and the fact that they need to have appropriate and adequate care across the country.
So where did this all begin for you, Sathya? How did you get to where you are today?
Anthony, I migrated from India, started my career in Australia in a rural Victorian town. And the very first patient I had happens to be someone with a severe borderline personality disorder. And I had no clue how to treat. And at that time, the science was very limited. I migrated from India. I graduated from the best possible university in India. But globally, we did not have the know-how how to work with people with personality disorders. And around the same time, Spectrum was being launched, although it was formally launched in 1999, 97 they started. People from Spectrum came to the rural town and helped me how to treat people with personality disorder. And that patient recovered. That opened my eyes, because I also believed at the time that you can't treat people with personality disorders.
Yeah.
So that's how my journey of my professional journey and the journey of Spectrum are very intertwined.
So no, we started working more closely together probably, I don't know, 8 to 10 years ago, and I'll be honest, I didn't really understand what personality disorder was. So I think there's a fair bit of stigma, or really, I think in the broader community, not so greater understanding of what the condition is, and I think also from being alongside you at many meetings over the years, I think what's refreshing for a lot of people is to hear from you how your confidence in being able to treat people and in a sort of a client group that sometimes, as I say, can be misunderstood or not treated, or treated in a way that's actually counterproductive to a good outcome.
Yeah, no, you're absolutely spot on. People with personality disorders and complex trauma disorders are hugely misunderstood, and there is a fair amount of stigma and added discrimination that comes from a belief that they are somehow if they are self-harming, or if they are suicidal, or if they come to hospitals very often, somehow people misunderstand that they're doing it deliberately. What is now clear in science that it is a disorder of the brain and the mind, and they have some habits that gets entrenched because of the kind of experience they've had in their life. And it's not easy to change those patterns of thinking and feeling. And we all know, even simple habits, we find it very hard to change. But what we know is that it's a disorder which is eminently treatable. And with good treatments that you're familiar with, what we do at Spectrum, the outcomes are brilliant. Most people get well, and very many of them recover and can lead meaningful lives. If there's one message that I want to get across today is that borderline personality disorder and personality disorders and complex trauma disorders are treatable.
Yeah, great, thank you. I could go on, and I'm sure you could for a lot longer. I just wanted to say thank you for having the privilege to be part of acknowledging the award that you received over the weekend, and I was thrilled to hear that you received it, and in September you'll be marching off to Government House, I think, to formally receive your award. But just wanted to say that I think it's really well earned, and really happy to see you being acknowledged in this way, both for yourself personally and also the work that you represent. And I think through the conversation, is an area that has significant impact across our health system and our population. And you're certainly a leader in making changes in that area. So thank you for the opportunity.
Thanks, Anthony.